The Turks and Caicos Islands has made another key step toward improving healthcare, with the arrival of 2 brand-new, state-of-the-art ambulances. As recent as December, a rented minibus with blacked-out windows was used as an ambulance due to the lack of regular maintenance to the ambulances on island. Dr. Rufus Ewing, Director of Health, explains how these new ambulances will improve emergency response time and on-scene emergency care.
There are a number of components to effective delivery of emergency medical services. The equipment is one, of which the ambulance is part of that. The staffing is the next. The staffing, over the past few months, we've had the service of Mr. Pat Reel, ambulance supervisor, paramedic trainer, and then we intend on, within the new budget cycle, recruiting additional emergency medical technicians who will try to improve the staffing levels in the service to ensure that we can get an effective response. And then the development of the protocols that goes with that. We also will be putting in place a maintenance schedule to ensure that these vehicles are maintained in a manner that is conducive to ensuring the longevity, getting the most the life out of these and service out of these vehicles. So we have to have a good, robust preventative maintenance schedule. As well ensuring that all drivers of the ambulances are certified in the emergency vehicle operation course to ensure that they drive it in a manner that will be well maintained.
Permanent Secretary of Health Judith Campbell and family doctor and member of the emergency team, Dr. Roger Callahan, were on hand to witness the arrival of these 2 new vehicles. They gave their remarks on how these new vehicles will impact emergency medical services.
It's a very exciting day for us. It means the completion of another project, very important project for the Ministry of Health and for the healthcare in Turks and Caicos. It means better response time to any accident. It means better and more advanced and modern equipment for our staff to work with, and I'm very pleased that this project has come to fruition.
The past 20 years have made a great difference, and there's been a lot of knowledge gained on how to treat people before they get to the hospital. We've got a state-of-the-art hospital here, state-of-the-art equipment, great medical teams, and now we've got the vehicles to give the emergency teams, who now also are very well trained, the tools they require. It means that people get to the hospital in the best possible condition, whether it's an illness or an accident, whatever's happened to them.
Pat Rial, the EMS paramedic supervisor, describes the features and the equipment on board.
It's a state-of-the-art vehicle. It's a bacteriostatic environment. So that means that the floor and the walls and the ceiling have been treated with, I guess, a scientific formulary that helps prevent any pathogens, viruses, or bacteria from living. So basically it helps kill anything that gets in here as far as disease process. So what that means is if we're carrying somebody that's ill and then a few minutes later we're carrying an elderly person who's otherwise well, this science allows us to rest assured that with proper standard cleaning, we don't carry further disease, which is a very, very important step. So this bacteriostatic environment is it's very common in operating rooms or in hospital emergency departments, and now it's spreading into the pre-hospital environment. So it's fantastic science, and we're certainly glad to bring it to the Turks and Caicos. Brand new state-of-the-art stretcher. It's a rugged model from Stryker. It's designed to deal with the rocks and the beach and all the nooks and crannies of the island that we get into on a given day. And it's just a lot more solid and rugged than the old silver metal models were. You can see the heavy-duty wheels and the bearings are all stronger. We have a new AED, which is a cardiac defibrillator that came with these units. We have technology. If you can see the phone, it's not set up because they just arrived today, but the phone is set up to endorse or help us communicate with online medical control. So, for example, if we need to get a hold of Dr. Ewing or an emergency physician at the hospital, we have measures and abilities to do that faster than we used to. So that's a nice feature, and we'll work with 911 in an ongoing way to make sure that continues. It has other extrication pieces of equipment that are all new. And It has complete immobilization equipment and oxygen and basically everything you'd want in a brand new ambulance.
He also explains what the next step for EMS is now that the new vehicles are on island.
We're going to be working jointly with the police department in their initiative to provide emergency driver training, and we're going to be doing visual exams on our drivers and that sort of thing. Basically negotiating the traffic and dealing with the public while you're operating an emergency vehicle with lights and siren is no small feat. It takes training and proper management of this resource. It's heavy, it's fast. And that in itself is an issue. So the training, which will start obviously immediately, will allow this to be negotiated through traffic safely, and we have to get within that 10 minutes. So the last thing we want is a broken down vehicle or an accident. So those are the things that we've addressed today.
Rial also added that the old ambulances will receive the repairs and maintenance they need to get them back up and running so that every other island has emergency response vehicles at their disposal. The leader and deputy leader of the People's Democratic Movement, Doug Parnell and Clarence Selva, also attended and shared their comments.
I think it's an important step towards making sure that the people of Providencia at least is well cared for. There's been several complaints, and I think that with these new ambulances, it should help to solve the public complaints that have been out there. And so I'm very pleased to see that these have finally been delivered.
We are happy that we at least have modern, brand new equipment to be able to respond to our people's needs in record time. We are delighted to have them.
For WIV4 News, I'm Denard Sweeting.